21 patients are downstairs with COVID-19.
And a week ago, there were none.
There was none.
A Westmoreland County nursing home is seeing a sudden surge in COVID-19 cases, going from nearly 0 to almost 24 in just 1 week. That spike at Bel Air Healthcare and Rehab in Lower Burrell has the families of some residents very concerned.
Boy, that's right, Peggy. 11 Investigates Angie Moreski's been looking into this. Joins us now live in the studio with what she's found. And Angie, this is raising a lot of questions.
David and Peggy, it certainly is, and not only because of the sudden spike in cases, but how they happened. Guardian Elder Care, the owner of Bel Air and about a dozen other nursing homes in the area, decided to bring in the COVID-positive patients from its other facilities, even though Bel Air had been nearly COVID-free for months, and families tell us they were never even notified.
So that's my mom.
Heather Stevens' mom, Donna, is a resident at Bel Air, and she was stunned to learn the facility was suddenly taking in COVID-positive patients.
And all of a sudden, you bring all these patients over to a facility that had zero. This is ridiculous. This is ridiculous.
Her family is worried their mom, who has Alzheimer's, is being put at increased risk for COVID-19.
Her immune system is very, very low, and if she would get this, she would not be able to survive.
Last week, the family first heard a rumor that COVID-positive patients would be transferred to Bel Air. It happened, and the numbers shot up quickly.
It started out with 2 patients, then it went to 5, then it went to 12.
Today, that number is up to 23 positive COVID cases at Bel Air in just 1 week. The increasing numbers posted here on Bel Air's parent company website, Guardian Elder Care. But the family says no one notified them about these cases, as is required by federal regulation. The family was even sent this letter in May, where the company told them, under a new rule, Guardian must notify them anytime a resident or staff member tests COVID-19 positive.
We're very upset. We were not contacted. No one has contacted my dad. No one has contacted me or my brother, none of us.
I feel like we feel a little bit deceived and betrayed.
Why didn't we get notified about this?
Heather had a hard time getting answers from the home and called 11 Investigates for help.
I am calling to find out more about Bel Air beginning to accept COVID-positive patients.
We contacted the nursing home, then its parent company, which declined to do an interview, but sent us this short statement confirming Bel Air is now a dedicated COVID-19 recovery unit and that patients are being cared for on a separated floor apart from other residents, but no explanation on why.
We want to know why. Why don't you tell us, Guardian? Why don't you tell us, corporate? Why did you bring these patients over? You're choosing money over lives. Is it really that worth it?
We sent follow-up questions, and the company did respond, saying Bel Air's physical plant provides a distinct environment to deliver safe care to COVID and non-COVID patients. It also said Bel Air is following federal and state guidelines for care, including separate entrances, protective equipment, and no crossover of staff between COVID and non-COVID patients. They say money was not a consideration for the change.
Our focus remains the safety of our patients, residents, and all of our caregivers.
Guardian has several videos posted on its website talking about the seriousness of COVID-19 and touting the company's response. The family says they had been happy with Bel Air until now, especially since they're being kept out while COVID-positive patients are being brought in.
You're seeing a loved one through a window. That's hard. You can't hug them. You can't kiss them. And now, with them bringing patients in, who knows when we'll be able to see her again.
Now, I've been going back and forth with Guardian and the state on several questions about this today, and it is very hard to get a direct answer. In my last exchange, Guardian acknowledged it did not notify families individually, but says it told them in a letter that they could get updates on COVID cases online, which they say is state guidance for this. Federal guidelines do call for specifically notifying residents and families about any new cases, not simply posting numbers. And David, I talked to another nursing home owner who says it is unequivocally a state and federal mandate to notify a resident or a responsible party in writing of new COVID cases, and they have to have proof to back that up. One thing is certain, that's a lot of cases in a very short period of time.
Angie, such an important story. Thank you for bringing it to light, and what a powerful and heart-wrenching interview as well. I know you're going to continue to work to get answers. Thanks.